Hi, I'm Dr. Mike Ursiny. I'm a urologist at Fore River Urology. This video is a brief description of the key elements of your upcoming vasectomy consult. This video is created as a resource for you and your partner to prepare for the consultation, and also as a resource to review at your own speed and convenience, both for decision making and potentially through your recovery. If you're coming to Fore River Urology seeking information about a vasectomy, you can anticipate that at your consultation, your doctor is going to ask you some basic background medical questions. You'll get a quick exam, and then you'll have the opportunity to ask any questions and fill out any paperwork you need to fill out. And hopefully your entire visit should take no more than 15 minutes. Let's get into the basics here. So first off, let's talk about the anatomy. So let's imagine here we've got a scrotum, two testicles. Testicles have two primary functions. The first is to make testosterone. The second is to make sperm. Testosterone is unaffected by a vasectomy. Testosterone travels through the bloodstream and is distributed that way, and so that's unaffected. Sperm have their own dedicated plumbing system. So they travel from the testicle through a tube called the vas deferens, after which the procedure is named. There's a mirror image on the other side, and they bring the sperm internally to the prostate. And there they mix with supportive fluids, proteins, sugars, and that mixture is called semen, and that's ultimately what males ejaculate. So a vasectomy aims to block the pipeline so the sperm can't join into that mixture and cause a pregnancy, because sperm are ultimately what cause pregnancy. Vasectomies can be done a number of different ways from a technique standpoint. Typically, a short segment is removed, some form of blockage is applied, whether it's a clip or a suture, and that can be done on either side. Cautery using heat or burning is used, and sometimes urologists will interpose some connective tissue as a mechanical barrier. And then you do the exact same thing on the opposite side. So you can think about vasectomy as a straightforward mechanical approach to contraception that won't affect other systems in your body. So I wouldn't anticipate any changes to urination, sensation, libido, erections, orgasm. All that stuff is going to stay the same. The only difference will be that when you ejaculate, 3% less fluid will come out. Most people are not particularly concerned with that. So a couple key things to know up front before you pursue a vasectomy. The first is to make sure that you definitely want a vasectomy. It should be viewed as permanent. Vasectomies are reversible, but reversals don't always work. So it's not something that you can count on 100%. And typically, vasectomy reversal is a expensive out-of-pocket procedure. So important to make sure that you're making the right decision. Second, even though vasectomy is a highly effective and highly successful form of contraception, it's not 100% successful. It's about 99.98% successful. So generally, the failure rate is around 1 in 4,000 nationally for patients who adhere to all the guidelines and in terms of post-vasectomy testing. And third, when you walk out of a vasectomy, you're not sterile right away. And the reason is that there are still viable sperm in the upstream portions of the pipeline here, and those sperm can cause a pregnancy, and it takes them on average about 3 months to fully wash out. And so we have all patients go have their semen tested 3 months after a vasectomy to confirm that the vasectomy took hold and that all the viable sperm have washed out and that you're officially all clear. From a timeline and logistics standpoint, the only thing that patients need to do to prepare are to trim or shave the hair on the front of the scrotum. Procedures are most commonly done in the office under local anesthesia. So it's about a half an hour appointment. The procedures usually take about 15 or 20 minutes typically. So you'd come in just like you did for your consultation. You'd be lying down on an exam table, just like you're getting examined. a tiny needle is used to numb a little area of skin on the front of the scrotum, and then we numb the nerves that run right alongside each of the vas deferens. So it feels like a pinch on the skin initially, and then it feels like you're getting kicked in the scrotum for about 5 to 10 seconds. So it's a little bit uncomfortable. After that, the rest of the procedure just feels like you're getting examined. So pulling, tugging, pressure, ache, but really no sharp stabbing pain after you've been numbed up. The entire procedure is done through a tiny little opening right in the center of the scrotum using the no scalpel vasectomy technique. At the end of the procedure, sometimes you don't need a stitch, sometimes you do. If you do need a stitch, they would be absorbable. You don't need to come back for any suture removal. And then typically patients are walking out of here under their own power. Recovery is 2 to 3 days. Swelling, soreness, scrotum typically swells to the size of an orange. So your job is to, excuse me, wear supportive, tight-fitting underwear, use lots of ice, 20 minutes on, 20 minutes off, and you can use Tylenol and ibuprofen at your, based on what's written on the bottle for any anti-inflammatory and pain relief, but you shouldn't need anything more than that. After about 3 days, most patients have returned to about 80% or so, I would say. Typically can go back to work depending on their job. For the first week or so, we don't want patients to do any vigorous sports or vigorous activity, no heavy lifting beyond 15 pounds, and no ejaculation, so that you don't develop a hematoma or some kind of complication. After about a week, patients can return to full activity with no restrictions. And the last time point on the timeline is getting your semen tested 3 months after the vasectomy, which can be done at any nearby lab that will do semen testing for you. A couple complications or risks to be aware of. We talked about vasectomy failure rate is about 1 in 4,000 procedures nationally. Bleeding and infection can happen to about 1 in 250 patients. Chronic testicle pain is a known risk of vasectomy as well. Fortunately, that's extremely rare. Epididymitis is a mild infection of the structure next to your testicle. Typically, that's treated with antibiotics, and that resolves the issue. And lastly, there's something called sperm granuloma that can form in about 25% of men. It's a pea-sized lump that can form near any one of the testicles. It's completely benign. It's not cancer. It typically doesn't cause any notable symptoms. I just like patients to know about it beforehand so they don't freak out about a lump they discover on their testicle. So those are the key things to know. There's also important things to know about pain control during the procedure. So there's 3 options. The first option is, as I described, just numbing with the local anesthesia with the needle. That's typically what most patients choose. Option 2 is adding a Valium pill to the local numbing medicine. So Valium is an anti-anxiety medication. You would have to request it. We'd send you a prescription to your local pharmacy a couple days in advance. You end up taking that 1 tablet about an hour prior to your procedure, and it will impair your driving. So you need somebody to give you a ride to and from your procedure. I've seen mixed results. Some patients it really helps them a lot. Other patients it doesn't seem to do much at all. The last option is combining the local anesthesia with nitrous, or also known as laughing gas. That's available at our office. That is patient-controlled conscious sedation. So it means that you're a little bit sedated, but you're fully conscious and you're awake and you're interactive. But it works very well at decreasing procedural anxiety, and it also decreases pain sensitivity for patients. So the procedure is more comfortable. At the conclusion of the procedure, the nitrous also washes out very quickly, and so patients may hang out in the waiting room and just recover for 10 to 15 minutes or so, and typically they're actually safe to drive themselves at that point. The downside with nitrous is that insurance companies don't pay for it, so it usually comes as an additional fee to patients if they want that option. So those are all the key elements that you need to know about vasectomy before you come to your consultation. And come armed with questions, and we'll see you soon.